The human mind is one of the most beautiful, powerful, and fragile things we possess. It carries our creativity, our memories, our faith, and sometimes our pain. But what if healing could begin, not just in the heart, but in the mind? Join us for the Beautiful Mind series, 6 nights of truth, tools, and hope for mental peace and wholeness. From May 4th to May 9th, every evening at 7 p.m. on Zoom. Discover biblical insights and practical skills to help you navigate grief, anxiety, depression, trauma, addiction, and loneliness. Because peace of mind is possible, and healing is within reach.
Good evening again, everyone. Welcome back to the Beautiful Mind series, Remedies and Skills for Mental Peace and Wholeness. Can you believe we have come to the 5th night in our fascinating series? Again, my name is Jimmy Ferguson, your host, and I have the wonderful privilege also of serving as pastor of the Sharon Temple Seventh-day Adventist Church. Tonight, we have part 2 with our Tuesday night presenter. Again, I invite you, I warmly welcome you. Sit back, relax, and anticipate an enriching experience. Again, welcome everyone.
Our presenter this evening is Dr. Beverly Gordon, who was with us on Tuesday and talked about anxiety. After spending her early years in Jamaica and England, she migrated to the United States of America in 1979. She lived and worked in California and then Michigan. She now lives in Pennsylvania, where she has spent the last 42 years. She has a strong commitment to her Jamaican heritage and has contributed significantly to education and mental health services over the years. Dr. Gordon holds a doctoral degree in clinical psychology and has degrees in counseling psychology and nursing education. She has worked in various capacities in nursing, behavioral health, and higher education since the late 1970s. With over 25 years as a registered nurse, Dr. Gordon transitioned to psychology and counseling, working with children and adolescents. In private practice, Dr. Gordon expanded her services to address family and marriage relationships as well as grief counseling. She is a certified family life educator and certified Prepare Enrich provider for married couples and persons preparing for marriage. Since 2008, she has held academic positions at DeVry University and Washington Adventist University, and currently serves as chair of the psychology department at Delaware State University in Dover, Delaware. Dr. Gordon is a published author. Her notable work, Native Foreigner, addresses acculturation stress among Black immigrants. She has also contributed to various professional journals, devotionals, and served as a reviewer for several academic publications and professional conferences. Dr. Gordon is involved and active in her church and community. She was co-chair of the Jamaica Diaspora Task Force, Action Network Behavioral Health Task Force, 2019 to 2020, and chair of the J.D. Tan Health Task Force, 2020 to 2022. She currently serves on the Women's Commission of Montgomery County in Pennsylvania and serves as coordinator for the Family Life Ministry at her church. Dr. Gordon is a committed Christian with a passion for fostering strong human relationships. She candidly admits to a lifelong Christian philosophy that guides her work and values. She has a passion for enriching the lives of families and a deep respect and love for young people. She has a rich background of multicultural exposure in her personal and professional life, and these experiences have translated into a delight and enthusiasm for working with people from diverse cultural, socioeconomic, and religious groups. Dr. Gordon is the proud parent, along with her husband of 45 years, of 2 fine adult sons. Of all her accomplishments, her most treasured titles are wife, mother, daughter, and friend.
All right, so I'm so glad that you were able to join us this evening, everyone. And we are going to talk a little bit about trauma. Now, when we think about trauma, a lot of times we associate it with stress. We become overwhelmed. And not only that, but the event has a lasting physical and emotional effect. So what are some forms of trauma that can occur to individuals? Traumatic events could happen to men, can happen to women, it can happen to children. And some of these traumatic experiences include rape, domestic violence, child abuse or child neglect, assault, robbery, or property crime, damage to your home or car with violence involved, witnessing a murder, living through a disaster like a hurricane or an earthquake, serious threats made to a person or the person's loved ones. There's a lot of what we call scamming going on these days. And people have been traumatized by receiving phone calls or emails or text messages that actually threaten them in various ways. And this can be a traumatic event that leads to lasting physical and emotional consequences. An automobile accident is another form of traumatic experience. Racism can be a traumatic experience. An exposure to gun violence, of which there is so much in our society today. There are 4 basic types of trauma, and I'm going to talk about these and explain them just a little bit. First one is acute trauma. This involves a single incident that is overwhelming and has a lasting effect on the individual. The second one is chronic trauma, as opposed to acute, which is one incident that occurs. Chronic trauma is where the person experiences a prolonged, repeated exposure to this traumatic event. Complex trauma, that's the third one, complex trauma, which involves multiple events of different types. So, for example, with chronic trauma, someone might experience abuse, physical abuse over time, and it's repeated again and again and again. With complex trauma, the individual experiences trauma over and over again, but not only do they experience trauma over and over, but it's different types. So the same person who is being physically abused might find themselves in a hurricane, a serious hurricane, or an earthquake, or they might have lost their home because of a disaster. And so it becomes complex trauma because it's more than one source for that overwhelming feeling that the person is exposed to. And then the fourth type is vicarious trauma. And this is where individuals who, for example, deal with mental illnesses or deal with seriously ill people in an intensive care unit, or someone who is a firefighter or a policeman, may be exposed over and over again to other people's suffering, and they actually, through empathy, experience the feeling of being overwhelmed and the lasting effect, just as if they were the ones actually going through the situation. So vicarious trauma, and actually therapists are very prone to experiencing vicarious trauma because, of course, they listen to sad stories a lot, and they experience other people's suffering, and can, over time, if they don't take care of themselves, can experience vicarious trauma. Trauma has physiological, psychological, sociological effects on individuals who experience trauma. In children, children experience trauma through what we call adverse childhood experiences. And this might include physical abuse, but it could also include something called bullying. And bullying is a really huge problem these days in the schools. So a child might be called names, get beaten up, just taunted and terrorized in their school environment, for example. And this bullying can have a lasting effect on the child. Now, there are certain responses that we give when we experience trauma. And 4 of the types of responses to trauma include fight, which means actually confronting the danger, going towards the danger and confronting the danger, or flight, which means escaping, running away. And sometimes sometimes that's actually the best response, but it just depends on what the situation is. Freezing. So someone can become stuck. They're so terrified that they actually can't do anything. And so they become stuck, whether it's physically, can't run, can't move, can't get out the way, or it could be emotionally. The person knows that they need to take action, know that they need to do certain things to remove themselves from the danger, but they're stuck. They're so terrified, they're stuck, and they can't do anything about it. And the 4th response is fawning. And in this one is more lasting and difficult to unravel, because the person becomes a people pleaser. Because of the trauma that they have experienced, they try to avoid conflict. They try to avoid situations that would cause them to get hurt again. And so they sacrifice their boundaries, and they become people pleasers, and they suffer from being a people pleaser, but they can't quite get over that response without some help. Now, different people respond to trauma in different ways. And some of the factors that influence our response to trauma include temperament. So some people are quiet. Some people are more vivacious and talkative, and even assertive and sometimes aggressive. So depending on your personality, your temperament, it is likely that you will respond differently to a traumatic event. So there are some people who will not actually have so much of an emotional disorder following a traumatic event, because they will respond with fight, not flight, but fight. And so they will rise to the occasion, and they will fight the situation, or they will fight the person or the thing or whatever it is, and actually not really feel overwhelmed, but they're experiencing a traumatic event nevertheless. Then there are other individuals who will withdraw and be afraid and run away and avoid. And I think I mentioned on Tuesday evening, for anybody who was here on Tuesday evening, that the more we avoid the source of our anxiety, the greater our anxiety becomes. But when we're able to face our fears, that actually helps to alleviate anxiety. Another factor that could influence our response to trauma includes culture. So with different cultural beliefs and different cultural norms, someone might choose to be very quiet in the face of danger, and might feel that it is not okay to tell anyone about what's happening with them. And so they will suffer in silence. Other cultures are very outspoken, individualistic, and will take action. So cultural norms, cultural beliefs, cultural practices can sometimes influence how we respond to trauma. Gender is another factor involved with how we respond to trauma. The statistics show that men and women both both experience trauma, but men are more likely to experience certain types of trauma, and women are more likely to experience certain types of trauma. Now, the interesting thing is, I'm going to talk about post-traumatic stress disorder in a little while. And the interesting thing is that more women are likely to develop post-traumatic stress disorder than men. Even though originally post-traumatic stress disorder was associated with individuals who went into combat, experienced war. And that's where the whole idea of post-traumatic stress disorder came from. But nowadays, both men and women go into combat. And so what we found is that women are more likely after a traumatic event to develop post-traumatic stress disorder. Also, women are more likely to seek treatment, which might actually influence the statistics about women being more likely to experience PTSD because they might be the ones who show up for treatment. And women take longer to recover, according to the statistics. Women take longer to recover from post-traumatic stress disorder than do men. These then are factors that influence our response to trauma. Now, when we've experienced a traumatic event, certain coping responses might include things that are not positive or things that are not healing in nature. So, for example, someone might turn to substance abuse. So someone might turn to alcohol or drugs as a way of trying to cope with the trauma. Another traumatic coping response is actually depression. So the person withdraws and isolates themselves from social contact. Persons who have experienced traumatic events may also have developed dissociative disorders. Dissociative disorders serve the function of kind of separating you from reality. So if you can withdraw into this place where you are not who you are in real life, or you experience life in a almost like a unrealistic fairy tale way, then you don't. The idea is that you won't feel the pain of the trauma. There was a famous story about a young woman named Sybil. I don't know if anybody might be familiar with that. She had experienced a lot of physical abuse, and she withdrew into this fantasy world. And the purpose of that type of thing is to protect oneself from the reality of the pain that the person is actually bearing. Post-traumatic stress disorder, of course, is one of the most common responses to traumatic events. There is another disorder that's not frequently talked about that is similar to post-traumatic stress disorder. It's acute stress disorder. And the symptoms are pretty much the same as for post-traumatic stress disorder. The difference is that the symptoms begin immediately after the trauma, and they last for anywhere between 3 days and 1 month. The person might have had a direct experience of a traumatic event, or they may have witnessed the event as it occurred to others, or they might have had repeated or extreme exposure to this traumatic event. But their response, their psychological response, only lasts between 3 days and 1 month. With post-traumatic stress disorder, which is the most frequently diagnosed disorder resulting from trauma, symptoms begin within the first 3 months. So the event could occur today, and the person does not begin to show symptoms of post-traumatic stress disorder until there might be a delayed response. And so maybe it might be 2 weeks, a month later, that the person actually starts to show the symptoms. But generally, the symptoms will emerge within the first 3 months after the traumatic event. There is clinically significant distress and impairment. The person is not able to function in a normal way. So there are the specific symptoms that occur. We can put them into three categories. One, intrusion symptoms. So the individual might have flashbacks. In other words, they keep remembering the event that occurred. And so they have these flashbacks, recurrent, involuntary, and intrusive, distressing memories of the traumatic events. Or the person might have distressing dreams. And so they either play back in their dreams the event that occurred or some version of the event that occurred, and it's distressing to them. The person might respond to cues in the environment that resemble the actual traumatic event. So, for example, someone who might have been in combat and they developed post-traumatic stress disorder, they might be in a situation where fireworks are being used, on a July 4th holiday or something like that, and the sound of the fireworks might sound to them like gunshots, and they might respond to the gunshots as if they were responding in combat. And so their behavior will be sometimes bizarre, because they could be a simpler situation. Someone could be, say, in a doctor's office, and they're sitting in the waiting room, and somebody slams a door real loud, and they hear that door slam, and they have a hyper startle response. So they'll jump, and the person might duck under the chairs or something like that. They're taking cover because it sounds like shots being fired. And so this is a possible response to a traumatic event. I mentioned the hyperstartle. Individuals with post-traumatic stress disorder, they are hypervigilant. They're hypervigilant. Oh, somebody just put something in the chat that's very relevant. A good example, a jackhammer on the street. Yes, that sound that might sound like, because it's a continuous type of sound, and it sounds like gunfire, and they might respond as if they are in the situation that created the traumatic experience for them. Okay, another group of symptoms would include avoidance. Remember, the first one was intrusion symptoms, which involves that flashback, dreams, and hypervigilance and hyperstartle response. Avoidance is the next group. So the individual will try to avoid anything, any situation, any person, anything that resembles the traumatic event. So in this situation, the person might refuse to leave the house, because if they leave the house, they're going to be see persons or situations or things that will remind them of whatever the traumatic event was. Someone might be afraid to be in the house by themselves because they may have been attacked. They may have experienced a rape or an assault. And so they avoid any stimuli that arouses recollection of the traumatic events. The third group of symptoms include negative alterations in cognition. So the individual may have been a happy-go-lucky man or woman or child, and after the traumatic event, they start to show more negative mood states and decreased positive mood states. So in other words, they're more often sad than happy. And they find it difficult to be lighthearted and happy when other people might be in a happy situation. They might be vigilant and serious, and because their brain is telling them that there is danger, and so they're constantly on guard to prevent themselves from being hurt. Person might also experience depersonalization. This is a feeling of being detached from oneself. So it's like being outside of your own body, looking in or watching yourself doing whatever it is that you're doing. So it feels unreal. The person feels depersonalized, just unreal. Then derealization is where the surroundings, the environment seems unreal to the person. So things might look distorted or sounds might be distorted. And they have this surreal kind of feeling that the things around them are not real. So we have the symptoms, intrusion symptoms, avoidance, and negative alterations in cognition. You know, I just kind of had to mention this, that there is a disorder that is not really classified in the Diagnostic Statistical Manual of Mental Disorders, but this is based on studies that was done by Dr. Joy DeGruy. She's the author of a book called Post-Traumatic Slave Syndrome. And she describes post-traumatic slave syndrome as a condition that exists when a population has experienced multi-generational trauma resulting from centuries of slavery and continues to experience oppression and institutionalized racism in the present. Multi-generational trauma, together with continued oppression and absence of opportunity to access the benefits available in the society, leads to post-traumatic slave syndrome. As I said, it is not an official diagnosis, but it's a term that's used to describe and explain some of the remnants of oppression through the institution of slavery in our society. But here's the thing. Whatever the form of trauma, whatever the source of the trauma, whatever the traumatic event, it affects the brain and it changes the brain. So there's a part in our brain that's called the amygdala, and the amygdala deals with emotional experiences. And then there's another part in our brain that's called the hypothalamus. And the hypothalamus is kind of like it's a control center. And it kind of directs how we respond to the messages that come from the amygdala. So in someone who has experienced a traumatic event, the amygdala is somewhat overactive. So it picks up sounds and cues in the environment that indicate to the amygdala that has now become hypersensitive to danger. It picks up these signals and interprets them as danger. And so it sends the message to the hypothalamus, your body's in danger, body's in danger. And so the hypothalamus then triggers glands in our bodies that produce hormones and other chemicals such as adrenaline and cortisol. And these substances cause us to go into that response, that stress response, so that we're our heart's beating faster, or our hands are sweaty, our respiration is faster, our muscles are tense, and all of that. And that's all getting us ready to respond to perceived danger. The problem in PTSD is that all of that would be great. It would be very good, protective, if we were actually in danger. The problem is the person is no longer in danger, but their body is responding as if they're in danger. And if you keep that up long enough, you know, those high levels of cortisol and adrenaline, it causes other responses, physiological responses in the body. And that stress can actually cause physical disorders that can even lead to death. So these are serious disorders. The person who is suffering from post-traumatic stress disorder they need to feel safe again, because they no longer feel safe in the world, in the environment. They need to feel safe. They need to have social support, individuals who are there for them in a consistent way, in a consistent, supportive way. They need to understand and relearn how to interact normally in a social context. Self-care is really important. Self-care is important for just about any disorder that I could talk about, really. There are several approaches to treating individuals with post-traumatic stress disorder. I'm not sure if I want to list all of these tonight. You probably won't remember all of them, but I'm just going to say a few of them anyway. Eye movement desensitization and reprocessing, EMDR. That is one form of treatment where the person learns to respond, to change their response to stimuli in the environment, and it has to do with eye movements and that kind of thing. And then there's prolonged exposure therapy, which is a long-standing approach to treating trauma and other types of fear and anxiety-related disorders. So prolonged exposure means that the person learns over time to tolerate being in a situation where the stimulus it could be disturbing for them. So over time, they're able to stay within that environment for longer periods of time until it's more tolerable for them. Cognitive behavioral therapy, where the purpose is to try to change beliefs, faulty beliefs, and erroneous thinking that influences how people respond to things in their environment. And then, of course, trauma-focused CBT, which then uses CBT, cognitive behavioral therapy, in combination with trauma-related theories as for approach. And then there's narrative exposure therapy and others. What I'm trying to say, though, is that there are evidence-based treatments that are available for individuals who suffer from post-traumatic stress disorder. And I know that sometimes as Christians, we feel that it's not necessary for us to go into therapy or, seek psychiatric or psychological help. I would venture to say that since God has given us wisdom and knowledge in these areas, it is probably beneficial. It would probably be wise for us to make use of these gifts and allow ourselves to make use of the treatment. So, for example, if we had diabetes, anyone who has diabetes will seek out a physician, and usually the physician will prescribe some form of treatment, which may include medication and other things, lifestyle changes and what have you. And we don't have a problem really using those resources. But for these situations that affect our mental health and our emotional well-being, there's treatment as well. And it's okay for us to use these treatments so that we can experience a better quality of life. So some of the treatments include talk therapy, which I just told you about some of the forms of talk therapy, otherwise referred to as psychotherapy. And this is actually the main treatment for PTSD. Then there are some medications that might be useful. Not everybody needs medication, and not every medication is for everybody, but certainly there are individuals, professionals who are trained in assessing and distinguishing between whether you need medication or don't need medication. And of course, it is true that medications have side effects. And so you might want to weigh the pros and the cons, the benefits and the dangers, of taking these medications. Also learning coping techniques, that active strategies that identify triggers and in the moment management techniques. I think I talked on Tuesday night about breathing exercises or meditation or just being in the moment, being aware of your breathing, being aware of your senses. What are you seeing? What are you hearing? What can you touch? What can you smell? And just taking that moment to just ground yourself in the reality of the moment and learning learning different responses to triggers that would normally create anxiety and trauma-related responses. Look for a psychologist who specializes in trauma and PTSD. Not all mental health professionals are trained to deal with trauma. So you might feel more comfortable talking to your pastor and he might even have a degree in counseling. That's great. But does he have, is he qualified to treat trauma and PTSD specifically? Or you might want to go to someone who is the same gender as yourself and there's nobody else available. But the important factor is, does this person have the training and the specialization in trauma and PTSD? You would not go to a dentist to check your eyes, right? And you would not go to an obstetrician if you had a pain in your foot. So likewise, when you seek out a mental health professional, make sure that the mental health professional that you go to is qualified to treat the problem that you're actually presenting with. All right. Some resources that might be useful for someone who is experiencing post-traumatic stress disorder: individual therapy. So individual therapy is where the provider meets with the patient or client one-on-one, and individual therapy. Then there's group therapy. So some forms of trauma actually respond better to a group therapy situation. This is where individuals with similar concerns and similar disorders might meet in a group with a trauma-informed therapist who then guides the interactions and the discussions and what have you, all the activities of the group in a therapeutic way, and the person benefits from being in a group with others with like situations, and they are able to be supportive of each other and to learn from each other, just as in the larger society we actually benefit from social connectedness. A support group. So a support group generally has a non-professional a lot of times as the leader of the group, depending on the nature of the disorder, the discomfort, or the maladaptive behaviors that are being experienced. Rebuilding trust is really an important factor in healing from trauma. Because a lot of times the type of traumatic event that occurred may have involved, for example, someone who was raped by someone that they know. That's a breakdown in trust. Someone who has experienced some domestic abuse. That's another area where there's a breakdown in trust. And so part of the healing is learning to trust again so that you can build relationships, healthy relationships within your social circle. And as always, I like to include something from the Bible. So post-traumatic stress disorder is a mental health condition that affects numerous individuals, men, women, even children. They've experienced traumatic events and they have tried to cope with their emotional turmoil. The Bible gives us comfort in that in many scriptures, you'll find, in many texts, you'll find that God invites us to come to him for comfort and for peace. And I just want to leave this one text with you. John chapter 16, verse 33. It says, "I have told you these things so that in me you may have peace. In this world you will have trouble, but take heart, I have overcome the world." And the fact that God is telling us that through Jesus And through what Jesus did for us, through his sacrifice for us and his life here on earth, he overcame the world. He's conquered death and the grave, and you can't go further than that. And so because of the fact that he has conquered all of that and he is now our God, we can have confidence that no matter what happens to us, he is able to bring about healing and peace. Thank you so much for listening to me this evening. May God bless you.
Amen. Thank you so much, Dr. Gordon. Thank you so much for taking time out of your demanding schedule to carve out this space for us and to share with us so freely from your background, your experience, your professional training. I want you to know that these 2 nights of presentations have been extremely rich. And the chat, even now, people are expressing their appreciation not only for what you shared with us this evening, but what you shared with us on Tuesday. We have a couple minutes. Perhaps there may be a question or two you want to put to Dr. Gordon in the chat. If you would do that now, we'll see if we can get a couple moments of feedback, and then we will move toward the conclusion of this evening's presentation. It has been rich. I have thoroughly enjoyed it. I wonder where the time has gone. Each of our presenters, we struck a gold mine. We really did. We struck a gold mine, and it has been invaluable. I do want to let you know that all of these presentations are housed on the Sharon Temple SDA Church website. Go under the media and click on YouTube, and you will see each night's presentation chronicled in order there. So if you want to go back and review these presentations at your own leisure, or to share them with a friend, neighbor, or loved one who could benefit from it, you can go there and find these presentation housed somewhere there. Dr. Gordon, would you venture to say perhaps most of us, if not all of us, have experienced some kind of trauma in our lives?
Yes. Yes, indeed. I would agree with that statement. We talked about different types of trauma.
Yes.
And so whether it's a man, woman, or child, most likely, and the statistics support that, most likely you have experienced at least one traumatic event, even if it's say for example a disaster, an earthquake, or a hurricane, or flood, or some type of something that disrupted your life and
Yes.
really took some time for you to recover from that something.
Okay.
And some people actually don't recover.
Mm. And depending on the severity of the trauma, it will impact us in various ways and to different degrees.
Yes, absolutely. And as another thing is that 2 people could experience the same traumatic event. One person develops post-traumatic stress disorder and the other person doesn't, because of those genetic factors, personality factors, temperament, and the amount of support that the person might have in their lives, social support. So many different factors can make the difference as to how the person actually responds to the event.
Okay. All right. Thank you for that.